I am, as Dan said, a child neurologist, and I do a lot of early diagnosis and management of autism in young children. And as I was sort of starting to see these kids clinically, one of the things that was very striking to me was the fact that many times children, especially when they were young and had limited verbal abilities, would seem as though they were extremely impaired across the board in cognition and functioning and perception. Yet there was a glimmer that that wasn't the case. It just that the tools we had to assess these kids were somewhat limited, meaning behavioral assessments, because their overt behaviors were a bit limited, especially when they were very young. And so I thought, what other ways can we really use to better characterize these kids? And that led me down the path to EEG. And so as I am a clinician, but I'm also a researcher, and our lab actually really tries to use EEG to better understand these children and to integrate our use of EEG and related biomarkers to really informing not only the clinical phenotypes, but also intervention. And so I'm going to talk to you today about some exciting work that we're doing here and kind of lay the foundation for kind of why we're doing this sort of work and the role for this type of work in the future. I do want to apologize ahead of time. Me being as obsessive as I am about trying to give good talks, I did make some changes to the talk over the last week after I gave Candace my slides. So the content that you have is there in your handouts, but the order might be a little different, and I've added some slides. So if there's anything that I show you that you definitely want afterwards that you don't have in your handouts, let me know. We can get you a PowerPoint. So I apologize. So if I hear a lot of rustling, I'm sorry, that's my fault. I do want to start actually by thanking all of the kids and families that are in our studies. I know I see a lot of familiar faces in the audience. There are some parents of kids who have been capped in our lab, and we greatly appreciate it because it's not the most fun thing in the world to get an EEG, but we hope that this kind of work over time really builds the foundation for, again, incorporating biomarkers with treatment. And then I'll do these thanks again at the end once you see some of the data, but I just wanted to start by thanking our families. So what I'm going to do is actually first give you a little bit of a background on what we know electrophysiologically in autism. Again, this field is somewhat in its infancy, no pun intended, because a lot of the work we do is based on what we've done, what has been done in typical development in infancy. But the use of electrophysiology to really understand kids with autism is a field that's fairly new, which again is what makes it very exciting, but sometimes challenging because we don't have a lot of foundation to work off of. We can't say, well, this is what's been shown in thousands of other children with autism, so if we're finding it here, it must be true, whatever that means, right? So it makes it more challenging, but again, very exciting. I'm then going to show you a little bit of data from our ongoing study, studying kids in the UCLA Early Childhood Partial Hospitalization Program, which is an intensive behavioral intervention for children with autism ages 2 to 5. Our study has been mostly focused on the slightly older kids, ages 3 to 5. These are children who range greatly in their abilities, but many of the children when they start are nonverbal and have a lot of difficulties with not only language and social cognition, but with behaviors. And in the clinical panel, next we'll talk a little bit about that. But we've been actually able to integrate with this clinical program to start really looking at biomarkers. And that's a really exciting collaboration that I think just really, again, sets the stage for the type of work we want to be doing in the future. And then I'll talk about future directions, kind of based on this early data and the ongoing study. How are we integrating our biomarker electrophysiological approach to look at kids in actual treatment studies? Going back to what is EEG, and unfortunately this has to turn into a little bit of a methods talk. I have to give you the EEG background because I can't just show you data and say, well, obviously, here's a difference, because I need to give you some information about what EEG actually is and does and why it's actually a promising methodology. So EEG is essentially the recording of the brain's electrical activity, and it's produced, that activity at the scalp is produced by the synchronous firing of neurons. So one neuron's activity does not give you an EEG signal, but many, many pyramidal neurons in sync do give you an EEG signal. So we get this signal at the scalp, but it's really reflective of what's going on throughout the brain. And in our lab, we actually look at children with 128 electrodes, which is much more than what is used for clinical EEG or actually in many traditional electrophysiological studies. It's called high-density EEG. What's very nice about our system is that it gives us a lot more sort of spatial resolution because we're getting information at just many, many sites on the head. But also those nets, the electrodes are on a net. So instead of individually having to place these electrodes, we can actually put a net on a child's head in one fell swoop. Now, I made it sound a lot easier than probably my research assistants would vouch for in terms of how easy that is. And here's one example of sort of how we net these kids. So that's the net that goes on the head, and then what happens is a child will sit in the lab and we can look at their resting state activity, meaning what is the child's brain doing when they're just relaxing, if you would consider this a relaxing situation. And we can look at what the brain does in response to a variety of stimuli, right? So when they're looking at pictures, listening to sounds, and we can in real time then get information about that, and I'll get into that in a little bit more detail. But I will say I have an amazing team, and most of the kids are pretty happy. And that takes time in terms of really working with our lab and others to really figure out how best can we make these kids comfortable in this testing environment. Because I will say, when I mentioned kind of the studies that have already been done in this area, a lot of people don't want to touch little kids with autism. They don't want to study those kids because it is challenging. These kids are very, you can't rationalize as easily with them or, provide them with sort of typical rewards after the testing is done. And so we've had to take a lot of approaches from the infancy literature and also from other clinical populations to think about how can we best get the best possible data from these children and make it fun for them and comfortable for them. And that's been a work in progress. So from the EEG, we get several types of information. We first get information about just frequencies. So the brain waves we see on the EEG, again, are reflective of this synchronous firing of neurons. Frequencies vary from very slow to very fast, and those different frequencies tell us different things about brain states. So for instance, when we're sleeping, we have very slow activity in our brain, and actually the way we define sleep stages is based on how much slow activity there is in the brain. And that you see, sorry, I'm gonna stand over here, sort of with this sort of activity. Then you get into slightly faster frequencies like alpha, which I'm gonna talk about with one of our findings. That's an oscillation that's generated when the brain is in sort of restful wakefulness, right? So if I put an EEG cap on your head and had you just relax and close your eyes, we would see really nice posterior alpha waves. And then we can look even faster, and some of the faster frequencies, as I'll get to, give us actually, we think, more information about actually synchronous firing of neurons and bringing together cortical networks. So we can get a lot of information about brain states just by different frequencies. The next thing we can do is actually take that EEG and from that, process it to look at what is happening in the brain in response to a stimulus. Okay, and that's called the event-related potential. So it's the electrical potential related to an event. So with this, we can actually get information about how in real time does the brain process something, be it a visual stimulus, be it an auditory stimulus. We can look very quickly at how the perception is happening, but then also over a little bit sort of later over the course of a recording, over a segment, if you will, we can see, well, fine, the brain perceived it this way, and then how did it process that information? So we can look at that in real time with these event-related potentials. And I'll just tell you a little bit about what we look at in the ERP, because I'll describe these sorts of variables when I show you a couple of our findings. The main two variables we look at are latency and amplitude. Okay, so latency is how fast did the brain respond to a stimulus. Differences in latency have been thought to reflect how fast is processing happening. If one group is much faster than the other, that might suggest that they're better at processing it, or it might mean that they need less networks to come together to process it. There's lots of different interpretations based on the paradigm, but latency tells us speed of processing. We then can look at amplitude. Amplitude tells us how big is the processing. So was there a big brain response to something? And again, amplitude is the variable that we've had some really interesting findings in our ASD sample. But again, it just gives a sense of how big was the neural response. And then we can look at scalp location. There's some challenges to this, and there are ways that we can go about really getting better information about where the activity is coming from. But if you think about it, because we're only getting data from the scalp, and neural activity is being generated from throughout, especially actually in the subcortex, you know, we don't have the exact spatial resolution we of course would with imaging, like MRI. So why EEG? Okay, so, and this is actually, again, an important foundation sort of to get to the steps of talking about some of our data. I mean, for the first answer to this, and I said this in my intro, so I won't go into it too much, but it really opens the door for us studying young and nonverbal kids. And I never will forget, you know, the parent that I had when I was, I think, a fellow in child neurology. And I was seeing her child who had autism, who was 4, and she said to me, you know, he keeps getting the lowest scores on all of his IQ testing and language testing, but I know he's smart. I know there's something going on, and there's no way to capture it. You know, and for me, that's very compelling, because I feel like, you know, you as a clinician, you want to say, I want to look inside and see what they're actually experiencing. What are they processing? EEG affords us that possibility, which I, again, find very exciting. And it's the reason that I, again, do this research. But more than that, from sort of more of a cognitive neuroscience standpoint, if you will, it provides us information about perception, cognition, and different brain states. And the perception piece is important because the temporal resolution is so exquisite, it provides us with information that the behavioral testing won't give us. Because by the time something's processed and then an overt behavior has been generated, that's a lot of time that's passed and a lot of processing that's happened. With the EEG, we can actually see those steps before the behavior actually happens, or maybe instead of the behavior happening. And I just sort of said this, exquisite temporal resolution. The resolution we see is in milliseconds. And it's pretty phenomenal. I mean, we perceive stimuli within 10 to 20 milliseconds of seeing it or hearing it, very fast. You know, what we consider higher level cognitive processing in ERPs happens within the first second of a stimulus. So our brains process information extremely quickly. Actually, Susan talked about this in her talk as well. You know, are genes actually influencing brain development and brain functioning, and how that then affects behavior. With EEG, we're sort of getting at the brain and at behavior, really. So again, a lot of promise there. So the ultimate question, which I am going to end with, and this is sort of what, meaning this is sort of the last piece in the step work in terms of where we want to get to. And the goal is that in the next few years, we'll be approaching answering this question. And sort of was the title of this talk, is how do we use these biomarkers to better inform treatment options and predict treatment response, right? We really want to be able to say, when a child's diagnosed, based on your electrophysiological profile, your imaging, your genetics, this is the category your child might fit in best. This is the right treatment for you. That's what we want to do. It's sort of like personalized medicine, really, you know, but really getting at the details of what is that child's profile. Before we can do this, and before we can really use EEG to help us with this, there's steps we have to take. The first is that we have to know, does EEG actually differentiate kids with autism from typically developing kids? Are there signatures of autism, you know, that we can see electrophysiologically? The second related question is, do these EEG biomarkers actually inform or correlate with behavior? So, you know, is there an association or a correlation between what we see in the brain and what we're actually seeing behaviorally? Because you can't use EEG to predict the behavior if there's no sort of baseline association. And then finally, can we use EEG biomarkers to look at change over time, right? So do these markers actually change? You know, the question that always gets raised, I'm going to bring up the study in a couple of minutes because it raised a lot of interest in the field. It just came out a few months ago. You know, this question of, does treatment change the brain, right? That's sort of an area of great interest. And that is something that we have to sort of establish and look at before we can get to question 4, which is, again, the ultimate goal of our whole research endeavor, I think, at UCLA, really, with our various modalities. I'm going to give you one sort of background slide about what has been done in ERPs and autism already. And really the goal with the ERP work that's been done thus far, and I'm not going to give every reference because this would be an hour talk in itself. Myself and one of my mentors, Chuck Nelson, who's one of the gurus in infancy ERP work, wrote a review on this topic a couple of years ago. So I can reference you to that. But what people have really done is looked at domains with ERPs that are important for core deficits in autism. The area that's been most studied with ERPs is emotion processing and face processing. So there's a huge literature looking at, do kids with autism process faces differently than typically developing kids? And the answer is yes. And now when I say yes, that's a very simple answer to a very complicated question. There's lots of different ways to look at it, but the classic example of a paradigm is showing a child faces and objects and seeing if they differentiate the two and in what direction, if you will. There's a very specific ERP brain response to faces, and what we find is that in typically developing children, they absolutely differentiate faces and objects, and they have a very face-specific response to faces. Kids with autism show the opposite effect. They actually show a sort of a face response to objects, which is, very interesting. And it suggests that, well, is there a core deficit in face processing which that affects their social cognition, or is it that, earlier impairments in brain development are actually affecting the way they process faces, which then leads to a deficit in sort of social cognition. So it's hard to sort of know what the directionality is. This is the kind of work we're doing looking at our infant siblings longitudinally, but in terms of, again, group differences, that's probably the area that's been best studied. In terms of language, people have looked at language and auditory processing. This work has primarily been done in older, high-functioning children, just because there are some challenges in looking at language processing in little kids. And essentially, the studies are mixed, but many ERP studies have found that language processing is impaired in children with autism. And then there's been a host of studies looking at sort of higher-level tasks, if you will. Attention isn't really higher level, but executive function, working memory, reward processing. And there have been differences that have been described. Now, I sound like I'm being vague in terms of saying there are differences being described, and the reason is that the studies really depend on the populations being studied and the types of paradigms used. One overwhelming common theme in all of the work that's been done thus far is that the 99% of the studies focus on older, high-functioning kids. Which is a great way to start. But the issue is that one of the joys of EEG and ERP is that we can actually tap into these younger kids who might not have the language and the IQ to do the behavioral testing. So why not look at those kids with ERP? A domain that I'm going to talk about next that has not really been studied with ERPs in autism is implicit learning, and it's an area that's actually been nicely studied with imaging, including with Susan Boekheimer and Mirella DiPreto showing differences in statistical language learning in older kids with autism. Implicit or pattern-based learning is a very important domain we think, for both language acquisition and development and for social cognition. And so, can we really look at implicit learning in these kids, and does it correlate with their phenotype? Does it even differ, between autism and typically developing kids? In terms of resting EEG, what I will say in terms of the background of what we know in terms of autism and typically developing kids is that, again, this is a very new field, emerging literature, but the real take-home point with resting state oscillations is that there's been several studies now showing that children with autism do tend to show lower power in certain frequencies, gamma being one of the most commonly studied ones. Gamma is thought to sort of be this high-frequency oscillation that represents essentially, again, the coming together of networks for a task. And so the idea is that if it's an adaptive, if it's adaptive to have sort of higher gamma because it helps you kind of bring online certain circuits to do a task, lower gamma might actually be a problem. And that's sort of what's been shown in early studies in autism. And then in terms of the background, and then I'll get to our data, going to those questions I was showing you, do EEG markers change with treatment? The one study that has looked at this that just came out about 3 months ago was a study by Jerry Dawson and Sarah Webb looking at children who had been in a 2-year two-year behavioral intervention program called Early Start Denver. And what they did was they looked at these children who were randomized to either 2 years of this behavioral intervention, and they compared them with typically developing kids and kids with autism who had not been in the treatment. So they'd been receiving community intervention as usual. And the question they had was, do the kids who are in intervention, who've received this intervention, what do their brains look like? And do they look more similar to typically developing kids or not. Now, again, the title of the paper is that the brain activity is normalized. It's a little tricky because they actually didn't study the kids before treatment. So I would say that, you know, what they looked at were the kids after treatment to see if there were differences in brain activity. But this was really the first paper of its type, and really is the type of work we're, again, doing here at UCLA, but it really set the stage for kind of how we can use possibly EEG in integration with treatment. And the paradigm they used, the EEG paradigm they used, was faces and objects, which I just kind of described to you. So they had good data in 15 kids in intervention, 17 controls, and then 14 community-based children with ASD. And I'm not going to go into the details of the components they looked at or whatever. I would ask you sort of to go more with pattern recognition. So these are your typically developing kids. These are kids in the treatment program, and these are kids with autism who did not go through the treatment program. And what they looked at was just in one of the components, the difference in amplitude between faces and objects. So the more negative, it's a negative component, so the more negative means they had a bigger response to faces. And what they found was that the typically developing kids had a bigger response to faces, as did these kids in treatment, but the kids with autism had the opposite sort of finding, essentially. And then they looked at brain activation with different frequencies during the paradigm, and essentially, again, just focus on pattern recognition in the interest of time. They found that the typically developing kids looked very much like the kids in treatment, unlike the community kids. So this was actually named one of the top 10 research achievements in autism by Autism Speaks last year, and has generated a lot of interest and questions. And I wanted to bring this study up because, again, it sets the stage, but also because this is where our field is moving in terms of integrating EEG with treatment. So let me quickly show you some data from what we're doing at ECPHP. And again, I'm giving you sort of some bullets and glimpses of some nice findings we have, and then I'll talk to you about a study that we're doing moving forward. So we have been studying children from ECPHP for the last year and a half and these are children enrolled in this intensive intervention program. Wonderfully, it's one flight up from our lab, so the kids essentially come down at the beginning of their treatment and at the end. They're in treatment for about 3 months, some a little less, some a little more. And our controls are typically age-matched controls. So these are kids who are not IQ matched, they're all typically developing kids. And we study the controls as well 3 months apart, because one of the questions is if we saw change, is it because that's just what would happen in 3 months, right? So we need to see the controls after 3 months as well. The paradigms that we're running in the lab right now, and this will evolve as we continue to collaborate with ECPHP, is we first do just resting state, and I'll show you what they see during resting state. The second is a visual implicit learning paradigm, and I'll show you data from that. And then the last is a learning from joint engagement paradigm that I'm not going to talk about today. And then the behavioral assessments that we get from ECPHP are from the clinic. So we don't do, it's not a research program, so we gather all the data we can get from what's been gathered in the program, and then we test the controls just to look at their IQ and language. And so the paradigms, if you will, so at rest, the kids watch bubbles. Now this has been, I won't get into it in detail, but a source of great discussion amongst all the EEG labs in the country about what do we do for rest. Some labs are doing actually a live person blowing bubbles, but then the concern was, well, that's social because there's a person in front of them. But someone said, well, bubbles, have a sort of social implication, but if it's on a screen, and the ideal rest state is to just have them be in a dark room, sort of in silence. Try putting a 3-year-old with a net on their head in a dark room in silence. It's not going to happen. And so this was a nice compromise. A lot of labs around the country, ERP labs, are using this exact actually stimulus. One of the issues when we're looking at resting state oscillations is that the kids move their eyes to look at the bubbles, and eye movements can actually cause some problems. The second paradigm we're doing is an implicit learning paradigm, where we basically teach kids shape pairs. So they learn pair 1, pair 2, pair 3 over an exposure phase. And in the test phase, they're either presented with shape 1 followed by an expected shape 2, or shape 1 followed by a surprise shape 2. And we look to see if the brain responds differently to the expected and the unexpected. And so again, it's all passive, which is really tremendous. This is sort of the first type of work like this, looking at implicit learning in a passive way, because we can't do it behaviorally. So this is sort of our way to look at it from a brain standpoint, if you will. So I'm going to describe data from 23 kids in each group, and then a subset of those kids, I'm going to show you their resting EEG data. They're extremely tightly age matched. We have run more kids, but to get the age matching really tight, I'm showing you these numbers right now. And what you'll see is that from their behavioral standpoint, they are very different in terms of their abilities, right? So, and these are all with, very high or low p-values, if you will. So the controls are much higher in their adaptive social function, in their IQ, in their receptive language skills, and in their expressive language skills. First, with EEG power, what we found, and this is really great work done by a graduate student of mine, Kevin McAvoy, has been working diligently on this for quite some time, and there's been many challenges, but very exciting preliminary results. But what we're finding is that the yellow line is the ASD kids. There's significantly more posterior alpha power in our kids with ASD. And there have been a couple of studies in adults with ASD showing higher alpha power that actually inversely correlated with some important cognitive domains like attention. This is the first sort of marker that has been looked at in this age group. And so it's a very robust difference. And if you look at this is sort of just a topo map of this, and you can just, again, looking at colors, you can see that posteriorly this green and yellow are suggesting higher power. You can see in ASD posteriorly there's higher alpha. What's interesting, though, is that our alpha power correlates positively with language. And so the question is, so there's this group difference where alpha power is higher in our ASD kids, but it's actually correlating with better function. So is there something adaptive about having higher alpha power? And that's something that we've been discussing. But again, we're seeing this really nice, difference in terms of their neural signatures and a correlation with behavior. And after we can talk more about sort of my thoughts on this correlation. We're also seeing a significant difference in posterior gamma power. And this is in the direction that has been shown in our infant sibling studies and in a couple of studies in older kids, where our kids with ASD are showing lower gamma power posteriorly. What's interesting about the fact that the gamma power is lower posteriorly is that even though this is a resting paradigm, these kids are watching bubbles. So it is actually a visual task, if you will. It's a visual stimulus. And so, is it that during a visual stimulus, they're not actually, obviously the visual cortex is posterior in the posterior leads, are they actually not bringing together cortical circuits, as efficiently or as well, as robustly as our typically developing kids are? So this finding also was quite interesting to us. And in terms of change with treatment, because that's the big question, the only place we're seeing change, and this is just a trend, is in our gamma power. So this orange line, the bottom orange line are time 1 kids with autism in the 3 regions. The line above it are time 2 kids with autism in the 3 regions. And the top 2 lines are typically developing kids. So there's this trend towards an increasing in posterior gamma power with treatment, which also is really interesting. And with a bigger sample size, we'll be able to look at, are the kids who are showing an increase in gamma also showing an improvement in their language or in their behavior? So the implicit learning story is a little bit more interesting. I only have a couple minutes, but we're getting to the end. Okay, so there's a couple of really neat findings. So first of all, we're finding beautiful neural correlates of learning with this ERP paradigm. So that was like a big triumph because it's been a paradigm that's not been studied with ERPs before. The 2 components we're looking for are this early negativity, the N1, which really represents kind of early encoding in memory. So do they recognize the stimulus, right? So what we would expect to find is that you would have a bigger N1 to the expected condition because you're expecting it, you remember it. The P300 is a component that reflects attention and kind of surprise, if you will. It's been studied extremely robustly in other types of studies, but what we'd expect to find is a bigger P3 to the surprise unexpected condition. That's exactly the pattern we see in our controls. Bigger N1 to expected, bigger P3 to unexpected. In our ASD kids who actually are showing, so this difference is significant. It's approaching actually also in our ASD kids, but it's not. But what is different between groups is their neural response to the surprise condition. So if you look at the colors here and here, what you'll see is that they're differentiating conditions, but in the opposite direction. So our kids with autism have this bigger response to actually the expected condition, which is fascinating. It suggests that there actually is learning going on, but that what's salient to them, what's really drawing their attention, is the familiar, not novelty. What that means, again, is something that we can discuss afterwards, but this is really exciting and actually very interesting in terms of the fact that we might see learning in these kids with different sort of attentional mechanisms maybe on board. So here you see, this is just a waveform showing the unexpected condition. And the kids with our controls are showing a significantly greater P3 to the surprise condition. Interestingly, in our kids with ASD, that difference between conditions, which is really our marker of learning, right? Are they differentiating conditions? The bigger that difference between conditions, the better their social skills and the higher their IQ. So we are seeing basically a correlate between learning and behavior in our kids with autism. This is especially interesting when we look at what happens after treatment. So after 3 months in ECPHP, we are seeing a significant difference between conditions in our ASD group. So I said it was approaching pre-treatment. It's significant, but again, look, the direction is still in that opposite direction as controls. So after treatment, the kids are actually showing a bigger difference between conditions. And again, we now see that before treatment, the kids who have more learning have better IQs, better social skills, and we're seeing that marker of learning improves with treatment. So this might be an interesting marker of function, essentially, and it may be the potential for improvement. And that's something we still need to look at. So to summarize the EEG findings here, I've given you a lot of information, sorry. One is that we're seeing in ASD differences in resting state EEG power, higher posterior alpha, lower gamma power, and that we're seeing sort of, if you will, a reverse pattern of implicit learning in autism, which is more pronounced after treatment. So, I've sort of showed you how in those first 3 questions, the answer is yes, we can do this, and it's been done in other labs as well, and that we're very optimistic that we can use EEG markers to better inform treatment options. Amanda Gulstrud mentioned Baby Jasper, which is one of the studies on our Autism Center of Excellence. These are babies that are being entered into a treatment program when there's red flags for autism as early as 15 months. What's exciting is we will be actually collaborating with that study and getting EEG markers, looking at EEG markers in these kids at the beginning of treatment and then over the course of their treatment and longitudinally. So we can look at not only change in EEG over time in a controlled setting, but also really start to look at predictors of outcome. And with that, I will stop. So.